Hi friends, welcome to the Blueprint Nursing YouTube channel. My name is Abby and today we'll be reviewing the topic of epiglottitis. At the end of the review, we'll move on to a practice question to make sure you have a good grasp of the topic. This practice question will be similar to one you may see on your NCLEX Next Generation exam. Let's get started. When you think of epiglottitis, what immediately comes to mind? Maybe pediatrics, airway obstruction, medical emergency? Correct. Epiglottitis is a serious medical condition where the epiglottis becomes inflamed and swollen. Do you remember what the epiglottis is? A flap of tissue at the back of the throat. Yep. This area swelling can lead to an airway obstruction and is absolutely a medical emergency. So let's talk about what causes epiglottitis. It's caused by a bacterial infection, particularly Haemophilus influenza type B or Hib bacteria. Fortunately, the widespread use of the Hib vaccine has decreased incidence of epiglottitis significantly. Just as a refresher, do you remember when the Hib vaccine is administered? 2 months, 4 months, and between 6 and 15 months. Epiglottitis is seen primarily in children, but it can be seen in adults when caused by other infections, chemical burns, or trauma to the throat. What signs and symptoms would you expect a client with epiglottitis to present with? Have you heard of the 4 Ds? They are a great way to recall epiglottitis. The 4 Ds are dysphagia or trouble swallowing, dysphonia or a hoarse voice, drooling, and distress or difficulty breathing or a lack of oxygen. Since these clients experience a difficulty breathing, they may present in a tripod or sniffing position. Epiglottitis is considered a medical emergency because of how quickly it can turn into a complete airway blockage. So acting fast is absolutely essential for these clients. Diagnosis is usually made through a physical assessment of the throat, but this needs to be done with extreme caution. We do not want to trigger any further swelling and obstruction. Treatment typically involves an admission to the ICU for close monitoring. Antibiotics are often administered, as well as other supportive measures like oxygen and IV fluids. In severe cases, the client may need to be intubated to preserve their airway. Okay, now that we've reviewed epiglottitis, let's go over our practice question. When providing care in the pediatric ER, which clinical manifestation does the nurse find most concerning for possible epiglottitis? 1. A cough that is producing a yellow-green sputum. 2. Difficulty swallowing and nasal congestion. 3. Drooling and refusal to swallow fluids. Or 4. Retractions and increased respiratory rate. Take a moment to pause the video, think about your choice, and then when you're ready, press play and we will review together. Okay, let's review. First, let's think back to the signs and symptoms of epiglottitis. What are the symptoms we're looking for with this condition? The 4 Ds, you got it. So, dysphagia or difficulty swallowing, dysphonia, a hoarse voice, drooling, and distress or difficulty breathing and a lack of oxygen. Okay, now that we know what we're looking for, let's look through each of our answer choices. 1. A cough that is producing a yellow-green sputum. This option does not match the 4 Ds, so let's leave it for now and continue reviewing. Number 2, difficulty swallowing and nasal congestion. Okay, let's think about those 4 Ds. Are any of them listed in this answer choice? Yes. So we do have the client having difficulty swallowing, which is dysphagia. That said, the rest of the answer choice includes nasal congestion, which is not a specific symptom of epiglottitis. Number 3, drooling and refusal to swallow fluids. Are there any 4 Ds in this option? There are. Drooling and trouble swallowing, also known as dysphagia. Yes, so right now this is the correct answer, but let's keep reviewing before we make our final decision. Number 4, retractions and increased respiratory rate. Do these align with the 4 Ds? This client may be in distress and having difficulty breathing, which can be observed through their retractions and increased respiratory rate. But these are less specific symptoms of epiglottitis. So with that, we can cross this answer off. It looks like that means our correct answer is number 3, drooling and refusal to swallow fluids. Great job! Thank you for reviewing epiglottitis with me. Remember to subscribe to our channel so you can stay up to date on all things Blueprint Nursing. Also, be sure to check out our Facebook page, weekly TikTok lives, and our crash course to aid you in your NCLEX studying. See you next time!